What are the best wearables for tracking bladder activity? Right now, there are no consumer wearables specifically made to directly monitor bladder activity like bladder filling or emptying. Most fitness trackers and smartwatches from brands like Fitbit, Apple, Samsung, and Garmin focus on tracking heart rate, sleep, activity levels, and stress. These devices do not have sensors to measure bladder function or provide data related to bladder health or bladder cancer management. For people managing bladder health issues, especially those with bladder cancer or urinary problems, the main tools used are clinical. These include urodynamic testing, which measures how well the bladder and urethra are working, and bladder diaries where patients record their urination patterns manually. Sometimes, catheter-based measurements are used in medical settings for precise assessment. These methods are considered the most accurate and are recommended by health authorities for monitoring bladder function when needed. There are some new research projects and prototypes exploring non-invasive sensors that could someday measure bladder volume or activity. However, these are still in development and are not yet approved for everyday consumer use. Claims about wearables that can track bladder activity should be approached cautiously until they are validated by medical regulators like the Food and Drug Administration and supported by peer-reviewed research. Even though current wearables can't directly monitor bladder activity, they can still support overall bladder health in other ways. Tracking your daily activity levels, hydration habits, and sleep quality can help you maintain a healthy lifestyle. Staying active and well hydrated is important for bladder health, and some apps allow manual logging of fluid intake and urination times, which can be useful for managing bladder conditions. If you have concerns about bladder health or a history of bladder cancer, it is essential to consult healthcare professionals. They can provide personalized advice and recommend appropriate monitoring tools. Relying solely on consumer wearables for bladder-specific data is not supported by current medical standards. Always seek medical guidance for diagnosis, treatment, and ongoing management. In summary, while wearable devices are great for tracking general health and wellness, they do not currently offer reliable or validated ways to monitor bladder activity. For accurate assessment and management of bladder health, clinical tools and professional medical advice are the best options. Always discuss any new devices or technologies with your healthcare provider to ensure they are suitable for your specific health needs.